Ready?
Ready.
Hi everybody. The question came across by a fellow colleague about probing. How do we probe? What's the best way of probing? So this would be a good guidance for the team, the hygienist, and to be able to manage to diagnose correctly. The reality about probing is one of our oral dental signs. So to detect periodontal disease, even in the AAP classification that's recent 2019, attachment loss is important part of the diagnosing. Therefore, probing correctly is essential. And probing also is cross-matched with x-rays, radiograph, in order to know some areas there may have defects, and therefore the probing has to be managed very carefully around these defects. This is my favorite model, comes from my specialty days. It shows clear, and as it zooms in, the gum being clear, that underneath it there's a lot of unevenness of the bone, and that unevenness of the bone needs to be carefully managed in terms of probing. Radiographs will give you that. Anatomy of the teeth understanding that gives you that reference. So when you're probing, you're truly probing down to the level of the attachment, and interproximally you have to remember the interproximal attachment, which is very important here. If you go straight down, you're not in the interproximal, but when you go at an angle, you go in the interproximal. So for the interproximal measurement and probing, it's important to be in an angle and try to walk the probe to find that defect. So again, remember, even on the buccal, you may probe straight, but remember, if there's a buccal bone loss, you have to probe and find that defect. And even on the palatal roots in this view may have a defect. You have to walk and go along the palatal root to reach that defect and probe. These are areas that again goes with what you see. Now back to the diagnosis, where the AAP emphasizes remembering interproximal. You have to go around, angle, and walk your probe, find that defect, and probe the deepest area. Again, you angled in, angled along the root, fill the root, and go in and probe in the deep area. So the next thing also, besides probing, is mobility. That is essential. Mobility equals future tooth loss. So make sure mobility is detected and managed by adjustment or management of gum disease in order to stop any further attachment loss. Other than that, go do the right thing and probe. Okay.